Hello, I'm Dr. Deepak, Devakar, Head Transplantation in Bangalore. I will advise you regarding the side effects related to the hair transplantation. There are some expected things which can happen. The first step would be understanding the pain part. Pain is not a major factor. Pain is very minimal and it is something like a mosquito bite if it is in the right way. Now there is microneedles which are available which will help in giving a very small mosquito kind of a prick with which minimal anesthesia can be used without giving any side effects to the body. Anesthesia itself can cause side effects if it is overdone. So using a smaller quantity of anesthesia and at the right place will be safe for the patient. Now if you are going for a hair transplantation, there is some expected side effects such as some swelling can be there on the area. There can be minimal oozing which happens from the donor area as well as the recipient area. When we are extracting hairs, the area where the extracted hairs are done, there will be some amount of pain for 1 to 2 days after procedure. So you will have to start cleaning the area from the next day itself. You will be put on medications for reducing pain as well as some antibiotics. So there shouldn't be any kind of issues related to that. Pain will not be there during procedure. You will just feel it for 1 to 2 minutes at the beginning of procedure where anesthesia is administered. After that you will not have any pain throughout the procedure. After the procedure, on the day of transplant also, you will be able to comfortably sleep at night without any pain. You will be given medications to take care of the same. Next is about the swelling. Swelling can happen on the forehead during procedure and then this can trickle down and minimal swelling can come around the eyes. This is expected. In some cases, swelling can be huge, which is can be controlled with medications, and we'll have to understand the patient's health to advise related to that. Another expected thing is there is some minimal itching which happens on second and third day, which happens on the recipient area as well as the donor area. So the itching is a sign of healing, because of which they get some itching sensation and it is normal. If you are taking care and washing the hair every day, from the 4th day of transplant you can start washing the entire area, which will help in clearing the itching as well as the scabs related to transplant. Bleeding shouldn't be happening after the first day. So if it is happening, you should go back to the doctor. Now there are some unexpected things which can happen. Unexpected things can happen very rarely, and if it happens, immediately it should be contact the doctor. Rarely anesthesia side effects can happen which is on the table. So if a person is not qualified to do the procedure, risks are there. So you should find a qualified doctor to do the procedure and look at their patient experiences, on which you will get an idea on what is their experience when they underwent the procedure. Unexpected things such as swelling can last beyond 7 days. There can be difficult healing. There can be some bleeding which can happen for 1 to 2 days after procedure. So these things all can be taken care without any major problems. So if it is done at a right clinic with a qualified doctor, none of these complications will happen. Expected things such as minimal swelling can be there, which can be countered with medication.